Good morning, everyone. I wanted to provide some updates as it's been a while since I've actually done this video presentation for all of you. Here are some of the updates on COVID-19 that I wanted to talk about today, as well as about a survey that Clinicas has conducted specifically to telehealth services, which is something that we have started or adapted very quickly due to COVID-19. So let's talk about the COVID-19 trends that are there right now. Unfortunately, in the United States, we've had more than 2.6 million, just over 2.6 million positive cases so far, and over 127,000 deaths. So this data is very current as of yesterday, and I'll be talking more about how we are seeing a surge or continue to see a surge in these cases, which is absolutely very concerning. So this particular graph talks about the new cases, and you can see exactly what I'm talking about. So we were in the beginning of COVID and about in mid-March, and we saw our first surge around April. And the hope was that by this time we would be seeing a plateau or a complete decline in cases, but unfortunately we have seen a second spike. And as you can see in this particular graph, this spike seems to be much higher than the first spike that we had in early April. So currently we are averaging in the United States about 46 to 47,000 new cases every day, and I think we hit the record high yesterday with 46,000 cases in a day. Moving on to the other thing is about looking at the death rates in the U.S. So, you probably are following on the news right now where there are, different schools of thoughts, and some people believe, of course, if the testing goes higher, then we will have more positive case. True, but along with that, it's also, we have to look at the hospitalization and the death rates. So this particular graph was seeming pretty positive until recently, as you can see that we had surged in the death rates in the country around late April, early May, and then there was a steady decline. We were about less than 1,000 deaths per day. But as you can see on this graph, we had another surge, which seems to be pretty much as the higher, same level as we've been the highest, which is around 2,700 deaths in a day. So again, this data is we are getting it from the website. So was this more of a backlog in a particular day, or it is the new trend that's going to be there? It's hard to say, but absolutely alarming that a death rate at this point should have been coming down, but hasn't, and it's actually spiked up. So talking about California in itself, as you can see this graph here, the blue line is about the daily cases, a trend that we don't want to see. And you can see here that our daily cases have gone up, and this is something which we do not want to be record high in, but we are hitting the record highs of more than 6,000 cases a day in California. So that's something that it is an alarming number, because we had definitely hoped that by the summertime, COVID would have been gone and we would be living a normal life. Unfortunately, we are not there. The green line in this is showing the death rate. And again, this is an accumulative data that the website of the California Department of Public Health is showing. So you can see it's going straight up, but it's accumulative data and not specifically for a particular day. But yes, the death rate is also increasing. The yellow line at the bottom is the ICU admissions, and they have been pretty steady, but we see a little blip up. Hard to say whether this is going to be going up, or there is an uptick in ICU, or is this just for this month of June. The other concerning line in this is also the hospitalizations, the red line, as you can see, and there is definitely an uptick which seems to be steady since the early or mid-June, I would say. So these are the things that we look at. Yes, more testing means more positive results, but more testing does not necessarily mean increased hospitalization or death rate, which unfortunately is what's happening right now. We see a surge in hospitalizations and deaths. So I've already discussed this as to what does the data really hold right now. Yes, increased testing is doing it with the increase in numbers, but the hospitalizations is very, very critical, something that we should be monitoring to see which direction are we heading towards. So let's talk about Ventura County. And another trend that I personally and many of you would agree with me, we are not something we are looking forward to. So as of last night, we have had 2,740 cases positive in Ventura County so far. And as you can see, this graph, we were doing so good until the beginning of June. And have we had more testing since then? Absolutely. We had more testing in May, but there were other things that happened in June, which was the economy started opening up at that particular time. Has that played a part in it? We'll be talking more about it in a little bit. But we've had a record high of cases over this past weekend. On Monday, we had 104 cases reported for a 3 day period. The Public Health Department of Ventura County has decided not to run numbers on a Friday, Saturday, Sunday. Must be nice to not have to work on those days. But unfortunately, the disease does not stop over the weekend, and so those cases accumulate and we see them high. So yes, we've had 404 cases on Monday, and as of Tuesday, we've had 186 cases. So it seems the trend, there's definitely a major surge that we are seeing in Ventura County. And so the increase has been more than about 3 times the cases what we were seeing in April or May in our county. The deaths in Ventura County, we've had a total of 45 deaths. So this particular graph is showing and on a daily basis as we get reported on the deaths. So there are some white areas that you're seeing which are blank. Those were the good days. Those were the days when we've had no death. And as you can see, we are steadily having some deaths, if not every day, every other day. And again, something to watch on, because as the cases increase, the next step is hospitalizations, because when people are detected with the virus, they may take longer to get sick. Many of them recover, but some of them unfortunately land up in the ICU as well. So keeping a close eye on this is important. And Ventura County Emergency is reporting these numbers on a daily basis. They even talk about the age group and if the comorbidities were there for the death rate. So it is interesting to look at these numbers in Ventura County emergency, the VC emergency, because in our county, more than 60% of the cases of COVID have been in the age range of 22 to 64. Although we believe that the high risk patients are 65 and over, I think it's very important to notice that the majority of our patients or people in this community are in that age range, which is actually not considered high risk. So what are we doing in Clinicas? As you all are aware, we have 2 testing sites where we are directing all our patients with any kind of sick symptoms, adults specifically, and testing them. So far, since we established our testing sites since March, we've done a total of 610 tests between North Oxnard and Moore Park, out of which we've had 67 positive patients so far. 484 have been negative, and we still have 59 pending results. We are sending our tests to Public Health as well as Quest, depending on which criteria the patient meets. And as there has been increased testing, there has been a backlog on the labs. So it varies on week to week basis, but we are getting the results anywhere from 2 days to 4 days. And again, we are keeping a tally of all the tests that we are running within our organization. To break down the further positive tests, we've had 60 who are patients and 7 have been staff members of Clinicas. And it is important to remember that none of these staff members have got the virus due to patient exposure. This has been more of a community transmission or from a family member that they're living with. But nobody at Clinicas as of date has been exposed to any patient leading on for them to be getting infected. So that is, I think, very critical, that the processes that have been set in place for all our safety and our patient safety have been working well so far. So it is very important and critical that we continue to maintain those processes in place and follow them. Follow every morning we have every employee and every patient, any person who walks into Clinicas is met with the greeter who's asking this, screening questions, doing their temperatures, and anyone who walks into any Clinica's property has to wear a face covering. If you're in a patient setting, you as an employee, you are expected to wear a surgical mask. So Yes, we've been doing this for 3 months. It is very annoying. Why do we have to do it? But unfortunately, this has become our normal right now, our new normal. And if this is working, this is what we are going to continue with it for now until we find a better solution to fight this virus out. So, continuing with the data on the COVID testing, this is week by week. The blue line on top is the number of tests we are doing, and the red line is the positive results. So, as you can see, as the weeks have gone by, we have increased our testing as well. So, starting June 1st, you can see our testing went up. In the beginning, we were getting more positive results, and as the weeks have gone by, like last week seemed we had less positive results. But I think it is important that we have the testing capability, and we test people who meet the criteria. At Clinicas, we have a particular criteria. We are not like the county drive-through sites, which is where anyone and everyone can go and to get tested. We have had set some guidelines about patients who are considered high risk, and right now we are even testing people who have come in contact with anybody with a confirmed positive COVID testing. So we expect that these testing numbers, given the current situation, are going to go high. And we are seeing it already in this week right now. I am currently testing in North Oxnard for this week, and just been a few days, and we see that the numbers of people coming in with contacts or who've been exposed is pretty high number. So we'll see what the upcoming weeks bring for us, but this is the data that we are monitoring on a weekly basis. So what can we do right now? I think I have shown you data which is very alarming, and but what can we do today? Yes, the solution that we think is we need some medication that can cure it, and we need a vaccination. Absolutely, these are going to be our final goal. This is where we need to get to, but making a vaccine takes a long time, and because it's a pandemic, every country is working and wants to win this race. But until then, what can we do? So there are certain things you can do as working in a clinical environment. There are certain things that you need to do as a community member. So number one thing as an employee of Clinicas is to follow the Clinicas processes, which are being set into place. And over a period of time, people start getting comfortable with what they are doing. But that's something this pandemic is teaching us. We have not been, I think none of us have been through this before, because the last pandemic was the Spanish flu, which was in 1918. So I'm pretty sure nobody was here at that time. So what we are learning from this is you cannot let your guards down with this virus. It does not spare anyone, and it does not give you a second chance. So with that, it is our duty as healthcare professionals to be educating our staff, our patients, and our community, which includes your families. So right now, what we need to do is, regardless of how sunny it is out there and how normal things look, it's not normal. This is a new normal where we should be staying home as much as possible. The next thing is, please do not participate in social gatherings. We are still considered in the midst of a pandemic and actually at a high surge. I've provided you with the data which is showing that things are not looking in the direction that they should have been today. So for now, the recommendation is, do not have parties. Stay away from, the 4th of July is right around the corner. There should be no reason. You should be with only your immediate family members that you have been living with right now. And any barbecues, which yes, we all love, we've always wanted. 4th of July cannot be 4th of July without having a barbecue. But this year it has to be. We have to find another alternate because we are in the midst of a pandemic. And the third point in this particular slide talks about face masks and how much have we gone back and forth in the last 3 months. Agreed. Initially CDC said there's no evidence supporting that, and now there is studies that are. So just as a reminder, coronavirus, or COVID-19 as we call it right now, started in December 2019. We have learned in the last 7 months a lot about this virus. So that's why the data has changed. So it's not that people are confused in what they're saying. It's just every day new things are coming up, and we need to adapt to those changes. And the good news is, until we find the vaccine, there's one thing which we have found with various studies that have been done in the US is that wearing a face mask, any kind of a cloth covering or any kind of face covering, there's a 85% chance that you are protecting yourself against coronavirus or the COVID when you're going out in a public setting and when you don't know the people around you. And just talking about not knowing the people around you, I have in the past 1 month heard, oh, I'm only going with people that I know because I know their behavior. My recommendation based on clinical knowledge is you cannot know anybody's behavior. You cannot know how much hand washing they're doing, whether they're wearing their face coverings when they're not around you, and where exactly are they going. So right now, my advice would be with your immediate family and don't trust anybody else about whether what their habits are. If we do this correctly, which we have done in Ventura County in April and March, we did an amazing job in this county and we had kept our cases low. So we just need to continue doing that. The fourth point is, if you are sick, stay at home. And I'm sure some of you are reading this and you're like, of course we know that. There's a reason why I put it here, because we all want to work, and sometimes it's like, oh, it might be just a sore throat, I can go to work. Being in a healthcare setting, we are seeing patients who are high risk. And so if there is a question, it's better to get tested. Talk to the experts who happen to be the clinicians at your sites. So that's the advantage of working in a healthcare industry, is you have physicians, you have clinicians right next to you. So we have set up processes where, if you are feeling sick, you are able to talk to a triage nurse who will have, run the case by the physicians that we have in a group who are triaging every single sick call. So I think it is our duty, like it is our civil duty, to protect people around us. It's the same rules apply for that at work. So if you are having any symptoms, please, please stay at home. We at Clinicas are able to provide you testing after you are triaged and somebody's gone through your medical history and your symptoms, and that way you're protecting your co-workers as well as patients who are coming here and who feel safe coming here. So reach out to the clinicians at your site or use this triage line where we are taking care of every single employee. And the last point on this is wash your hands with soap and water, not just at work, but everywhere else. Not only does it prevents the COVID, but any other kind of viruses. I think we have, that's something, it's a reputation, but it should be a habit by now for all of us and all our family members, because we need to get out of this corona battle soon. So the world, what does the slide say? The world is temporarily closed. Yes, it is. But a lot of time people are feeling that because the economy is opening up, the pandemic is over. These are two separate things. The pandemic is in the healthcare. It's a medical condition. The economy opening is a political issue. So those two things are not related. They are absolutely not related. If the nail salons have opened up in Ventura County 2 weeks ago, so have the cases increased in Ventura County. So have the hospitalizations. So please make a good decision for yourself, for your family, and for others. And like I mentioned before, most 60% of the cases, majority of the cases in Ventura County have happened to people between the age range of 22 to 64. So COVID is actually not deciding as to what your age range is. And yes, most of the people recover from COVID, but even currently we have about 60, I think 66 people in the hospital currently, of all ranges, of age ranges, and also 32 people in the ICU. So I think it's normal for anyone to feel, of course, it cannot be me, it is other people. But like I mentioned earlier, COVID does not decide. It's actually pretty unbiased and picks anybody and everybody who is not taking the precautions necessary. So once again, I understand everybody wants a vacation. We have been in this for literally 4 months. It's very stressful. We need to de-stress and we want to feel normal again. But we cannot, we have to be practical. We cannot close our eyes towards what's happening in the environment in our community right now. So there are ways of relaxation. Yes, please go out for exercise, not around people. You want to connect with your family. Use the technology right now, how we are connecting with our patients with telehealth. Use the same technology, do FaceTime with your family members, do virtual parties. Because if we can do that for another maybe 4 to 6 weeks, we will get out of this. So this is a take-home message which I think is important for each and everyone listening to this today, is that please, 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 the economy opening does not mean the pandemic is over. It is our duty to protect ourselves and not let our guards down right now. So I mentioned about telehealth a second ago, and I wanted to, we all have adapted to it very quickly at Clinicas. So there have been, many reasons for adapting to it is also because of keep making sure we as staff members are exposed to less patients. Patients feel safe getting their care, and because of that, there have been a lot of flexibility with Medicare, Medi-Cal, who have supported this pretty quickly and adapted to it. And so far in Clinicas, I've got very positive response from our clinicians, and our patients as well, that they are able to be seen at their homes and get the same awesome care that we provide at Clinicas. So one thing what we did was, I wanted to see was how adaptable our patients are. This is more of a hearsay, but data always helps you get the actual picture of things. So we actually did a survey of the migrant health farm workers. So this was a questionnaire about of 8-9 questions that I had created, and our goal was to reach about 300 farm workers. And I will we were very successful in doing that. And what we did was, as many of you have heard about it, that we have been also supporting another project which is called Feeding the Frontline, where farm workers have been given various produce, and there's a drive-through event. And so what we did was we took these surveys there, and with the help of some amazing staff here in Clinicas, myself, Andrea Mesa, and Leslie Barbara from corporate, we actually did these surveys in person at one of these feeding events on June 13th. So we were able to get about 50 surveys done there, and these were not patients of ours, but were farm workers who had come for the event. And the other approximately about 247 of those surveys were done with our Clinicas patients who are already established, and with the help of the health education department, which I'm very thankful for, we were able to complete this survey. So I have some results to share with all of you here. So like I mentioned, it is around 300, so it was a total, to be very precise, 292 patients that we were responses that we got for this survey, out of which 69% of them were females and 31% of them were males. So again, a lot of these surveys were done through a Survey Monkey on the phone. So it's also showing you the composition of how many people pick up their phone and what the age ranges were. So we decided to do this survey from 19 years to 65 years. And as you can see, the breakdown was from 19 to 30 years, there were 22% of the people who responded to this survey. From 31 to 45 years, there were 36%. And from 46 to 65 years, 42% responded to our survey. So the first question that, like I mentioned, there were 7 or 8 questions, but the first question was, do you actually have a mobile phone? And as you can see, 96% of the people who participated in the survey had a phone, and 78% of them had smartphones. And majority of that 78% had Androids over iPhones. And the rest, 22%, had featured phones, or as we call them, the flip phones, the opening phones. The next question was, what kind of data plan do they have, if they have any or not? So as you can see, 53% of our patients had some kind of a Wi-Fi, 62% of them had cellular data, and 19% of them did not have any internet access. So the third question was, what do you do with your phone? And no surprises, but 99% of the people who responded to the survey said they use it for talk and for voice calls. 73% of them were using them for text messages. 37% of them were using for emails, and 46% were using for web browsing, for any kind of search, and 54% of them were using their phones for different type of apps, which was like WhatsApp, Facebook, YouTube, and TikTok. TikTok was a pretty important one. And so the next thing was, the critical question after getting all that data was, what was their take on a telehealth visit? How would they be interested in taking that? And so the results were pretty astonishing, that 65% of the people from this survey wanted to do a telehealth visit, versus 35% of them prefer to be seen in person in a clinic setting. So we asked them, for the ones who were interested for the telehealth mode, what mode would they be interested in getting a consult from their physicians, and 86% of them wanted to get a telephone call. Only 16% were interested in doing a face-to-face visit, so like through a Zoom call or FaceTime or various options, or we have auto right now in Clinicas. And 3% of them were fine getting an email with the information, and 13% were okay getting a text message. So as you can see, majority of our patients wanted to be getting a telephone visit. So what are the next step in Clinicas? We got this great data. We know our patients are interested. Having a survey of 300 people is pretty significant, because the last survey, if you read anywhere, was published in 2013 with the migrant farm workers, with only 81 farm workers being surveyed. So definitely our patients are adaptable to doing telehealth visits or the virtual visits. So what are we doing now with this data? So what we have done is we are trying to optimize our virtual visits, which would be, a very normal step with knowing that our patients are receptive to this. And currently what we are doing in the medical department is we are standardizing visits, specifically like chronic disease or like a postpartum visit, for rashes. There's certain type of visit types that we are establishing with our clinical leads right now, to figure out what can be scheduled. Like if a patient is calling in today and says, I have diabetes, and there's a certain criteria that the call center can go through and automatically schedule these visits virtually. So, and what we expect is that at a health center, the clinician and the medical staff will be looking at their schedules on a daily basis, so we can optimize this. And another reason with this is also we have to maintain social distancing. We do not want our health centers to be crowded with a lot of patients, but we want to provide the excellent care that we provide. So this seems to be a great solution. We are working on just making the process more efficient. So the other thing is, for Medicare visits, we are trying, Medicare patients are considered high risk, and so we are trying to make all the visits as telehealth visits as much as possible, again working on optimizing them. So these are kind of the updates of what are happening in COVID and how things are working out. So once again, as a reminder, I think every one of you is doing an amazing job. These are definitely very tough times that we are in. I had really hoped that, like I had mentioned in my last video, this is definitely a marathon that we are running, and I was hoping that we would be towards the end of it. I think we have a few more miles to go, but I'm positive that, with the compassion, the enthusiasm that you all have, and we will be able to get our community out of this now so-called watch list by the governor of California. And educate as much as you can. Even if you're not at work, you have the most knowledge today as compared to people in our community. So please educate them that it's important for them to maintain the social distancing so that all of us are safe. And so just continue the excellent work that you all are doing here. Please follow the processes that have been kept in place. And as always, if you have any suggestions, any great stories, and anything that you think needs to change, feel free to reach out to your managers. And I would love to hear some positive stories, so shoot me an email, call me. Any positive stories at this point are going to be beneficial to all of us. And so everyone, keep safe, stay healthy, protect yourself, your families, and relax also. It's very critical. So enjoy the long weekend. It's right around the corner, but as again, we are not going to see the fireworks this year, but I think it's 1 year of not seeing it. I really hope that we will all be seeing that next year, which is 2021. I know it seems really far away, but I think for everyone to be safe is the most important thing right now. So take care, and thank you very much.